Good morning, YME community. Superintendent Rich Schneider with your weekly update. I'm joined by Crystal Enninga from our middle school, high school office. We want to give you an update. The incident command team did meet last night, and we took a look at the numbers. The numbers have changed, but not unexpectedly. So we'll review those right now if I can get this up and going. I want to start at the beginning. So once again, remember the safety is the most important. We did spend a little time last night in incident command team talking about how important it is that if we want to prioritize in-person learning, we can't continue to add more, do more activities. So I'll touch on that here in a little bit too. So here's your numbers. As you can see, Yellow Medicine East continues to be above the 50 cases per 10,000, but the highest county in our catchment area is Candy Ojai at 56.03. I anticipate there's going to be some dramatic changes in this. I don't know that Yellow Medicine's going to drop very far next week again. It's a little bit too early to say because we've had a great deal of fluctuations. We had days when we had 0 cases, and then we had days where we had double-digit cases, and sometimes that gets scrubbed out. And we know this last week, some of those cases that were reported in Yellow Medicine County ended up actually being reported in Chippewa County. So they got removed from our rolls. But then we did have some that came to us from Renville County also. So a little bit of fluctuation there. It's not an absolute science. This puts us squarely in both distance that we should be distance for all of our schools. We can separate out our middle school, but this is the model and the recommended policy that we should use. This is kind of gives you an outlook or the temperature of what's happening in our state. We are starting to see them more and more schools shift to changing their model. Some schools are like us where we're in a hybrid. We believe we can social distance. And so we'll stay on that. That's our plan for next week. So this is an update of what happened in the past week based upon what the Department of Health reports to us on a daily basis. This was yesterday's numbers. I haven't seen today's numbers yet, but from last week to this week, Yellow Medicine County increased by 26. We did have an increase of 1 death. Chippewa County, as we talked about last week, we were expecting a spike there, and that is what happened. They grew by 50 over this past week, but none of those were deaths. Renville County grew by 25 with Renville's population similar to ours. That's a significant increase. And again, 1 increase in the number of deaths there. We do have still information on the Countryside Public Health Dashboard. That's great information. That's pretty current. MDH is more exact, but this is pretty good information. Cases total right now in Yellow Medicine County as of yesterday was 259. Active cases yesterday were 40. The majority of those are in the community, meaning that they aren't in the other groups. A great example of the other group that we'd want to pay attention to is congregate living, and that could be nursing homes or any type of collective living scenario there. So the likelihood of transmission is it's in our community, and I'll talk about this at the end again. So this is the active case data. As I said, we're up 1. That doesn't mean throughout the week we only had 1 case come and go. That means maybe 3 dropped off and 4 were added on. So we have some right now actively in isolation, and so that tells us we do have it in our community. Chippewa County grew by 19 over this past week. So they also had some come off, but the net gain was 19 more. Lacaparo County went down 2, so that's good. We appreciate seeing that. So maybe some of the things that are happening in our community aren't having as great an impact in certain areas. Staff, we only had 3 days of school this week since our last video. Friday, Monday, and Tuesday. Wednesday, Thursday, and Friday, we did not have school, and that was kind of why we were comfortable with not having any, or with continuing with hybrid last week without doing any changes. Total staff, no change in any of that. We did see an increase of 4 students with COVID-related absences. That means they could be in quarantine due to a family or due to transportation. We saw an increase of that by 4, middle school, high school. Remember that number, we had a period of 2 weeks where they were in distance learning, but that increased by 7 from last week. There's kind of a snapshot of our attendance. We did have one day where the high school dropped down below 90% attendance. We know that that's not just related to COVID-related absences. There are other things that are occurring, but really the hallmark for us, the benchline for us is in that 90 percentile attendance. We start falling below that, we know we've got some issues going on. So this here is your zip code data. It tells you what's happening in the different cities. Granite Falls did see an increase of 10. Canby saw an increase of 10. Clarkfield, an increase of 4. Henley Falls, an increase of 4. Echo, still below that threshold of 6. And so I have no idea if that changed at all. Those are mainly the cities directly in our school district boundaries. Porter, no change. Wood Lake did go up 1. We have a lot of students that come to us from Wood Lake, but Wood Lake is actually, the city limits are within the Lakeview School District. Montevideo, as you would suspect, grew by 44. So the majority of that increase in the 50 active cases appear to be right within the city of Montevideo. And we do share a lot of students, a lot of services with Montevideo, so we do need to consider them. Predicting the future, we've gotten better at this, or Jeremy has gotten really good at this and scrubbing this out. So in the red there, that's what we reported to you last week based upon what we anticipated it would be this week. As you can see, at least one of those dropped out of that. So the actual, what we saw this week was 55.39, and that's really close to what the Department of Health reported also. Expected for next week, last week I reported that next week we would see 40.28. Now, in looking at it, we did add enough in there in situations where it looks like we could be up as high as 51.36 next week. Expected for 2 weeks, that's 2 weeks out. Nothing has been scrubbed out of that. That's the least accurate information. We expect that we will be at 45.32. If you look at Chippewa County, look at what we're expecting for them next week, 76.28. Last week, we had the third highest in terms of cases per 10,000 in the state. This would put Chippewa maybe even up into second place if they continue on that trajectory. So they are seeing a number of cases, and some of them are within their school. Couple reminders. I just want to review as we increase the number of activities, and I know we have things going on, and it's important that we have football and volleyball, but we did things like we opened up for indoor spectators at volleyball. And I'm not saying the State High School League was wrong in doing that, but as we do that, we increase exposure and we increase the risk of things spreading in our community. So we increase the likelihood of staff members having to miss school. That's one factor we consider, because that could be the one thing that stops us completely, like a snow day. We can't have school today because we don't have enough staff members. So it might not be just because they have COVID. we might not have enough substitutes to cover those classrooms. And I think Crystal, Nicole, and all of the admin staff deal with that on a daily basis. We are scrambling to find substitutes. So we increase the time and resources that we have to use for investigation. It takes a lot of work. We try and do it as accurately and thoroughly as possible, but that takes up time. We've had nights where we've been up there till 10 o'clock, still calling people on the phone and sending out our letters of contact and trying to conduct interviews. That's fatiguing for people, and people will make mistakes when that happens as we start to spend a lot of time at it. We increase the likelihood for the need for investigation. So we have a household contact, we might have to investigate that to see how is that then going to impact our school. Increase the spread of the virus, undoubtedly. If you look at the numbers, just one of my first slides talks about the number of schools or counties reporting higher numbers. Those are increasing. Well, what happened? We're starting to do more activities, and as we start to move about, we're increasing the spread of the virus. We increase the likelihood then that we would have to go to an on-site learning. So we will not be able to have on-site learning, I'm sorry. We would have to go to distance learning. Increase the workload for staff members because our numbers rise. So as we stay in hybrid and some of those students, those kiddos, end up being put into quarantine, as we increase those numbers, we're increasing the amount of work we're putting upon our staff members because they have to teach those students at the same time. We don't have extra teachers to just teach those distance learning kiddos. So a lot of work for our staff members. We increase the likelihood that students will need to be quarantined. We want students in person. When they miss school, we believe they get a worse product. We're worried about their mental health and the socialization aspect of education. So we increase that likelihood of them having to be quarantined and miss out on some of those. Just a reminder, parents transporting their own children, whether it's for sporting events or for school, that helps us. Any student on a transportation device, whether it's a van or a bus, where there's someone that tests positive for COVID, that 30-minute window puts person automatically, whether the windows are open and masks are worn, everyone on that bus or piece of transportation, mode of transportation, has to quarantine for that 14 days. So our focus continues to be to keep students in school. We can increase that socialization. The Department of Health and Countryside Public Health has announced that the Minnesota National Guard will be conducting a no barrier testing in Montevideo. And that kind of tells you that we are kind of in a hot spot right now. That testing, when I say no barrier, that means it's free, open to all, with or without symptoms. Any person can be tested. I encourage you to do that. I discourage people that are telling people not to get tested because we don't want to know. That's increasing the likelihood that things are going to spread. So let's find out if we have it. It's free. They encourage you to register. We send out information in an email. Crystal, thank you very much. And on social media, we will have posters up. It's available. The following week, they're looking to do something in Madison. We hope to have information about that in the next day or two, so you can participate in that, okay? Stop sharing. And Crystal, you have any questions or?
Questions? No. Really, I don't have a whole lot of questions other than, you know, the vote last night. Can you just kind of touch on that? How seemingly divided we seem to be the last couple weeks. I mean, it's been very close. So if you on that.
It was pretty impassioned again last night, talking about how when we say we want to have students in our building and then we do more and more activities, such as we'll talk about homecoming activities on Monday night. Is that something we want to do? Because again, that increases the likelihood of the spread of it. I'm going to pause here for a second and be right back to you.
No, we're good.
All right, and thank you for asking that question. That was a great question. So we do have that testing event coming up next week. I encourage people to participate. We do continue to see community widespread. So I kind of typed up something I kind of want to read here, make sure I get to all my points. Remember, we want our kids, our students in school as much as possible. You, the people of our communities, have expressed a desire to have our students in school, and I want them there too. We know of only one way that gives us the best chance of keeping our students, our kiddos in school, sports, and activities. But we need your help, and you can have a huge impact on it. This information is nothing new or nothing that you haven't already heard, but bears repeating it, as it's going to take all of us to make an impact or a difference upon this. Please help us keep cases low and our kids in school by following the very clear guidelines offered by the Department of Health. Avoid crowds, wash your hands frequently, wear a mask, stay 6 feet from others, keep family and social gatherings outdoors whenever possible, and stay home when sick. If nothing else, if you're not going to do it for yourself, do it for our students. All right? Anything else, Crystal?
Just my usual weekly reminders about dress. We are seeing a lot of the middle high school coming to school in t-shirts and very light clothing. Obviously, the last couple days, it's been way colder outside. I just want to stress that even if you have a middle high school child, please make sure they are dressing in layers, because we do utilize those outdoor spaces as well, just like the elementary. And again, please, you've been really, really good about leaving symptoms on, your phone and email messages. So please continue to do that, because that does save us a lot of time. Other than that, that's all I have.
Oh, and you bring up a good point. So if after hours, because sometimes we're getting those COVID results back after 6 p.m.
Yeah.
And we have no control over that, but we want to take action yet that night. So if you can call in and leave those symptoms on the nurse's extension, that will roll to her email, and then her and I will try and attack it right away as soon as we get that information. Cassie, Nurse Cassie's extension is 163. I have that memorized because I have to call her frequently. Extension 163, when you call in and you leave a message there, we'll get to you as soon as possible. Either her or I will reach out to you, and we'll start investigating as soon as we can. All right? Thank you, folks. Wear that mask, stay healthy, avoid social gatherings, everything I just mentioned. Have a great week.